element of this is that evidence-based policy making is actually understood in the same way by all of the different stakeholders or role players in the process. Very often we find that evidence-based policy making is understood differently by the different role players. So I think creating a point of departure that's understood in the same way is key. Another aspect, I think, is making sure that policymakers are involved from the beginning, that they are central to the process. And I think there's a lot that one can say around creating an infrastructure or a policy-making environment that lends itself towards using evidence-based processes and evidence-informed decision-making. Something else that I think is important relates to buy-in by leadership, buy-in by key decision makers within a policy process. And I think those are some of the critical elements of us trying to ensure that policymakers are sort of effectively involved. And just a final word, I think that in creating evidence-based policy, we have to make sure that we are responding to a really clear evidence-based policy need. So to address a gap, I think is critical, rather than just creating policies for the sake of creating policies. I think uptake of policy will be better if there is a clear need for it.
Well, I think one of the things we have to get beyond is this sort of north-south divide, or lower middle income country versus developed country divide. I think there are a lot of assumptions made about the capacity of other places, but I actually think the capacity is enormous. I think the bigger issue are the rules of the game and the barriers to entry for some of those firms or organizations that are really looking to engage more locally or regionally, but having the ability to access funding. So one of the small things we're doing in the Evaluation and Learning Office is a market shaping effort to get a sense of which local institutions are really capacitating to be able to do this kind of work. So we've just done a request for information of firms that would be interested in being on the radar screen, and then we need to work on the barriers to entry. So the assumption's wrong that the capacity isn't there. The capacity's there. I think we have to change the barriers to entry.
So I think starting from again putting communities at the center while recognizing and understanding that not everybody would be interested, and be respectful of that, but still their needs and their the policies that are being made, the decisions that are being made, to make sure that those decisions and policies are responsive to the needs of the communities, identifying ways and putting that at the center. That is number one. And through co-creation and participatory based approaches, including community-owned and community-led, that could be explored. I think here again, when we say co-creation or co-production, the shift in the power dynamics, for example, as researchers or as policymakers, it is also important for us to reflect on our own position. What opportunities are we creating for those who are most impacted to contribute their knowledge and perspectives into the process? So our role is more as a facilitator of knowledge exchange and not really a gatekeeper. So it comes as an important reflection point that how are we sharing that power with the community members?
It's simply by working together, okay? We can no longer have the silos where the researchers are on one hand and policymakers on the other. So it's a wrong process, because we need to start first break the silos, ensure trust between the researchers and the policymakers, and then the policymaker needs to trust the researcher that when the policymaker says that this is the problem that we really need to investigate, or that is of priority to the government, that the researcher will be willing to contribute meaningfully to that particular process. And it has worked. We have impact stories to show that this has really worked, And breaking that silo, it has led to the policymakers working with the researchers on particular issues, and eventually the researchers have been called upon to come and help the same policymakers in designing and implementing of other policies.
Yeah, I think it is about involving people who are affected by the recommendations that we make as guideline developers. So it's really promising to see that many guideline development groups actually involve patients or families. I think we can do more to actually involve communities as well. The exact way to do that, I'm not sure yet, but I think there has to be consistent conversation with communities from the prioritization stage, as well as during the development of research protocols, guideline development, and actually translating that into practice. So at all stages, really.
I would talk more about the role of policymakers in evidence-informed making processes. And I think what we see ourselves as Partnership for Economic Policy is the importance of co-production and the role of policymakers. What we believe is that policymakers must come up with the policy questions that we must really answer, or they are the ones who know best where evidence is needed. Because when we as researchers come up with ideas for research, we do not really know the needs of government. So where we need to go is think about putting the policy processes first, ask the right policy questions, and then from there we can pick up the research questions. And therefore that requires that we give the policymakers the first priority before the researchers come in.
Citizens are really powerful when it comes to what their voices can do. It takes a lot of effort to marginalize the voice of a collective citizen group. So if there are enough people that can advocate for what they want in relevant, contextualized, specific guidance that is adaptable to their context, they need to advocate for that. But the glitch in the system is that guidelines are written in such a way that it's not really accessible to citizens. So there's a work around knowledge translation for sure. There's work around how we turn evidence into practice for sure. But we actually have a task as evidence generators, as knowledge producers, and that is to provide the public and patients with the skill to use the evidence that we are generating.
I think policymakers want to use evidence in their decisions because they understand its importance. To help them to do this, we need to remove barriers like ensuring quick access to reliable evidence, building relationship with experienced consultants, and simplifying complex and technical documents into clear and short fact sheets and policy briefs. If they have access to this information, I think, generally speaking, they will use it in their practice and daily management life.
Well, I think that I have a personal experience like conducting a research earlier this year. It was mainly on the UK context. So, and one of the findings of this research was about that we found that there is a training gap on capacity development to build, let's say, long-term partnerships across all the actors, including, for instance, policy professionals. So I think that the way to ensure this is ideally for the future. One of the lessons is that we should ensure that this involvement could be ensured, bringing together all the actors, but literally not all the actors. With this I mean like not only the usual actors such as, let's say, policy professionals or practitioners or the academic community, but also other ones such as voluntary community services or the business sector. So I think that that's the way so you can create evidence-based policies, bringing all together and not the usual roles.
Anthropogenic changes are surpassing planetary boundaries within which humanity can thrive. Consequently, climate change has emerged as the most significant global threat to public health in this century. If I could weave a magic wand, I would develop courses courses to introduce to health professional students to the planetary health lenses perspective, which is crucial to envisage a better future. Comprehensive strategies for teaching this perspective are lacking, especially in the domain of interconnection with nature and systems thinking and its complexity. There is a need to improve students' knowledge of planetary health, both in their subjective perception, such as sense of interconnection with the environment and the importance of its practical application, and when objectively measuring how many diseases they could relate to planetary health. So this is my vision for the future, improvement of especially health professionals' insights and perception on planetary health, that they are going to deal much more than we are dealing nowadays.
I mean, I love this phrase planetary health and the idea that we're trying to actively monitor that and recognizing our the actions that we take at having those real effects and asking, should we be doing this? And that's a big question. You know, the question, what on earth is going on, is a big one. But I think what strikes me in any discipline, whether that's environmental health or in health research, is that we know that people have different interests, but we don't always know what those interests are. And when I use the word interest here, I use it in a very specific sense, meaning that a person has an interest in a certain subject. So that might be a personal interest. And that's, you know, we need people with personal interests, so people with personal experience of, you know, certain health conditions, helping us prioritize and get involved. But there are also people with financial interests. You know, they might be shareholders. They might have jobs in certain areas where they stand to financially benefit. And there are also people with professional interests. You know, they might have spent their entire career focusing on a very specific area, and they really want to see more research in that area funded. None of these interests are good or bad in and of themselves. I think the challenge that the evidence synthesis faces is labeling those interests in a transparent way and saying, okay, you've come to us with this data. Who created it? How? Who paid for that data creation? Who analyzed it? And do the people involved have an interest?
And I think that it sounds ridiculous, but I mean, I'm here saying it, is if we just listened more, honestly, I think more problems would get solved faster. And if you think about all of the kind of stereotypes around, even in healthcare, people just not being heard by the experts, not being heard by their doctors, not being heard by researchers, not being heard by, and I think that in some cases, especially for people in fields that are about knowledge discovery and knowledge curation, it's like when you're talking, you're not learning anything because you're not listening. And actually, if we could find a way to almost make listening a core requirement of all jobs, I think we would actually solve, again, totally intractable problems that nobody has figured out how to do the way we're doing it now.